ideally, you want to obviously give somebody a timely review of their treatment, adjustment, new therapy, etc. in timely fashion to reduce the risk of somebody being on drug X or drug Y for months and months doing nothing for them. Meanwhile, time goes by and they come to harm, which could have been avoided potentially through more prompt review. Individuals also want more rapid and prompt consultation, but equally we're all living busy lives and not everyone can take time off work to go to a clinic slot. I'm supposed to be seen at 3 and I'm now being seen at 5:30. Whatever it is, you get the idea. We're all busy people living busy lives and life is quite tricky. And this is what the NHS is officially telling us. It's out there in the public domain already, in the sense that they're already telling patients in some clinics you can share your results online with your own specialist diabetes team, which is obviously great news. It's explaining to them that they can see blood glucose data that we can then share with them online through various means, and I'll come to that, as a way of conveying how good current therapy treatment choices are working for that person fairly promptly, and make rapid changes perhaps, which may mean you may not have to see the individual in clinic there and then, or you have to wait 6 months. And again, you can make partnership working and interpretation of results and numbers with the specialist team as well as a patient. And also, there's also the ability now where it's not too complicated to share data through a meter, books, etc., to be scanned, photographed, whatever it is. It's much easier to share data electronically in this context. And most people are relatively IT savvy. They have use of technology in their own homes, iPads, tablets, etc. So these are tools that are already out there, commonplace. We're not asking for new resources particularly, but we're just asking, using the means that are already available to people to help promote better self-care of diabetes where it's appropriate. And obviously there's the old school methods of using email and telephone, but you can imagine trying to convey certain information in that way doesn't always work the best. And it might just be you're thinking, oh my gosh, I'm getting overwhelmed with data, emails and phone calls, I can't possibly cope. So it's about thinking of your situation where you work, thinking what process might work for you, perhaps just do a little pilot project, look at a handful of people you think this might be a good flyer for example. And you may find that by doing it, working in this way, the sort of what might be regarded as an artificial need to review somebody every 6 months can be reviewed. You don't necessarily have to see someone every 6 months just because you can. There's no value to seeing somebody. Are you okay? Yes, thanks. See you in 6 months. Tick. It's pointless. So we're going to try and think about morphing our approach in the changing times. And by doing so, by supporting somebody remotely, it means you may be able to reduce the frequent face-to-face contact for the right person. And it may also mean you can give advice and guidance on the phone or online, as it were. And that can obviously help with changing insulin doses and that sort of thing, and saving time, giving the individual the skills and confidence to do it themselves before they contact you again, for example.